Again, my name is Dr. Aziz Associate Associate Professor at the University of Miami Miller School of Medicine and Department of Psychiatry, as well as Behavioral Sciences. I am the founding director of the Media and Innovation Lab, and I'm just so excited to have you here with my very dear friends from Neolth. Today's conversation will be addressing mental health crisis and using digital health solutions. And one of the things I wanted to share with you is that here at the University of Miami, we're here to serve you. We oftentimes have this saying, the you is here to serve. And the reason why this is important is because we are here to serve people from all walks of life, from the single mom to the family to older adults. And one of the things that we've realized is that we could do a better job in providing care and to support to the world. Why is this important? Well, it's important because our job is to be a trusted resource for you, the public. And so it's within this spirit that we created this seminar series with my colleagues from Neolth. Just want to highlight kind of the vision of the Media and Innovation Lab, that we really are trying to reimagine healthcare across 5 key domains. First, we try and reimagine education in terms of health and wellness. And we also try and reimagine how we care and deliver care. Also, we try and find novel ways in which we can understand some of our most vexing health conditions and to promote health and wellness for all. And we also try and create new solutions through our venture initiative. And last but not least, we want to ensure that we are fully rooted and embedded in communities through our service and outreach program. And so this initiative, this seminar series really speaks to our commitment to serve and to provide outreach. And here is why. The reason why is because we understand that we must educate and serve the local community, our global and our local community. So just want to welcome folks here from North America, and as well as some of my dear friends and colleagues from all over the world. Welcome. Mental health issues are an important issue that plagues us all. And so today, what we want to be able to do is to put this in perspective, that over the last 2 years, our entire worlds have been transformed upside up, right side up, because of this COVID pandemic. And even if you look in our own backyard here in South Florida, that you can see that many of our kids and our families have really borne a lot of the brunt of the pandemic, where we don't have enough support in terms of counselors. When you look at the counselor to student ratio, when we look at the amount of social workers, I know there's some social workers on as well as psychologists who can actually provide support and care. And you look throughout the entire United States, there's just not enough support and just not enough resources. And we truly believe that we want to be able to do that. And we're doing this through our outreach. So what we've done, we've partnered with some of our most trusted colleagues and our friends. And so I am just so happy to introduce my dear friend, Dr. Catherine Grill. She and I put this idea together to create an outreach seminar. And so I just want to thank her for her leadership, and also to, specifically give her a huge shout out for being recognized in, I believe, 14 or Forbes 30 out of 30. So Dr. Grill, please take it away. Welcome.
Thank you so much for that introduction, and so excited to be here again. Sorry everyone for the tech issues, but we'll record this and send it out to you afterwards. I'm thrilled to be here on behalf of Neolth, especially with this collaboration with the University of Miami. I think, as you've just heard, and as you know, mental health for young people has really been an issue. In the past, 10 or 15 years, we've seen a decline, and COVID has really accelerated that. So my background, I had worked as a therapist and as a clinical scientist with adolescents and young adults for a while, and really started to think, how can we increase access to care? How can we make things more equitable and more affordable? And that's ultimately why we founded Neolth, to use technology to increase access to care so every child could have what they need, and really to be able to deliver that care through the schools as a source of primary prevention. So that's a big part of our vision, is normalizing this mental health education and social emotional learning. The same way our students are learning math, science, even have PE class and are working on their physical wellness, we really want to make sure that they have access to the mental health resources that they need, that we're checking in with them on a regular basis, that it's really normalized in their lives. So that way we can come in and just make sure that this is something that they feel comfortable with, they have access to, and we can really attack, this mental health issue from a point of primary prevention. So that's a big part of what we do at Neolth. And if you could, thank you, switch to the next slide, that would be great. So the way I would describe our company, if you're not familiar with us, we're a technology provider. We provide both a mobile app and a browser platform for schools, for teachers, and for students. And we're really a tier 1, what's called kind of primary preventive mental health education platform that allows for seamless integration into your tier 2 or tier 3 services. So the really fun thing about Neolth, I think it's special to us, is that we worked with people like the University of Miami, people like educators, teachers like yourselves, and over 300 students who actually came through the company to co-develop, what could a mental health resource look like that's coming in and being delivered through the schools. And a couple of different points that Dr. Wheeler will elaborate on that we found were very important for these kind of mental health and SEL programs to have were assessment and progress tracking. We want to know what's going on with the students. We want to be able to see, remotely where they're struggling, what their needs are, and how we can tailor interventions to them. So being able to use a digital program can save schools time. We've heard from a lot of educators that they're going out and doing surveys with, still paper and pencil, or even trying to make their own Google Forms and to do assessment. Well, these digital programs can really save you time because they can do the assessment for you. They can send updates in real time, whether it's aggregate information about your whole student body, or if you're a school counselor, you can be enabled to actually track individual students that you're working with in care remotely in between appointments. So a really kind of nice way to aggregate this analytics and be able to keep you informed about student mental health. These programs can also provide, SEL education and this self-guided content. We've also heard from teachers that this is a big area where they're trying to introduce this into the classroom. As we've seen, there have been more Department of Education mandates. And we've heard from a lot of teachers that they're trying to create their own content. Well, we can, again, save you that time by having our doctors, our therapists create that content for you in a very easy to use interface so you can come in and integrate it into your classroom and really have that be part of the day-to-day for your students in this form of primary prevention. And then lastly, I think one of the very important things is to make sure that, it's not just a Bandaid SEL program, which is a term Dr. Wheeler will talk about, but make sure that there's that seamless care escalation to your tier 2 and tier 3 services. So something like a crisis monitoring system. We've heard from a lot of counselors that they're really stressed when it comes to holidays, weekends, what's going to happen to my students, what if they're struggling? Well, these digital programs are able to take that burden off of you by implementing AI solutions and these remote safety nets that can monitor your students 24/7 and make this real-time referral to care as needed. So these are a couple of the things we do on Neolth, but without waiting any further, I'd love to kind of jump into the conversation with Dr. Wheeler today, and would love to just introduce her very briefly. So our main speaker today is Dr. Claire Wheeler. Dr. Wheeler is the Chief Medical Officer at Neolth and also an Assistant Professor at the Oregon Health Science University and the Portland State University School of Public Health. Dr. Wheeler has an MD and training in integrative and emergency medicine, as well as a PhD in clinical psychology. She specializes in trauma treatment and stress reduction. Formerly had her own private practice, Mind Body Medicine of Portland, where she provided integrative health services, and has authored multiple books, including 10 Simple Solutions to Stress and Pocket Therapy for Stress. She's been a faculty member at PSU for over 15 years and a senior faculty member at the Center for Mind Body Medicine for over 20 years. So very experienced in student mental health and well-being, and excited to introduce Dr. Wheeler for her talk today.
Wow. That was quite an introduction. Thank you, Dr. Grill. I am Claire Wheeler, and I'm really happy to be here. I apologize also for the delay, but I'm excited to present this material to you. And all I have to do now, I guess, is share my screen. Just a second. This one, yes, and view slideshow. Okay, how am I doing? Can you, oh wait, now I can't see you. Can you see my slides? Are we good?
I don't think we can see. We can see you though, Claire.
Yes. Okay.
And which is totally fine. No, we can see your screen. Absolutely.
Okay.
Amazing.
And now I'm going to go into a slideshow. How's that?
Looks great.
Okay.
Never been
Thank
better.
you so much. All right, so I'm going to get going. As my good friend and colleague, Dr. Grill mentioned, I am an assistant professor at the OHSU-PSU School of Public Health here in Portland, Oregon. And I have worked in the field of stress and trauma probably, I guess, almost 35 years now since I was in college. Having been involved in higher ed as long as I have, I am acutely aware of the challenges being faced, especially by high school students as they come into the college environment, but also as a parent of 3 grown children and just a human being myself. And within my professional and personal lives, I'm very aware and concerned about this crisis that we're facing. So I want to take a sort of a bird's eye view of what's going on now in the context of COVID, but also in general around the mental health of our youth, and then sort of dive into some specifics about SEL and how we can most effectively teach it. Here are our names and where we work, and here are some learning objectives. We as educators, we love learning objectives, right? They really help plan what we're going to do and help frame what we're going to say. So I'm going to touch briefly on each of these things. I don't have a lot of time, but these are all topics that we could expand upon definitely in future seminars, and I would love to hear your feedback on the information. So let's start with what's going on in the COVID crisis right now. Students are in distress, and all of the major institutions in our country that are concerned with student well-being and the well-being of children and adolescents are saying essentially the same thing. What was already a precarious situation with respect to mental health and mental health services for our kids became a national emergency when COVID happened. And so recently, and I'm sure most of you are aware of these statements that came out from these various expert organizations, that things have gotten worse than they were before. So suicide was already a leading cause of death, even in children as young as 9 and 10 years old in the United States before the pandemic started. Another trend that we've seen in suicidality is that not only do we see more of it in children, we see it in younger, ever younger children. There are myriad reasons we could speculate causing this, but I don't have time to go into them right now. We go further. Oh, did someone want to?
If everyone could just maybe keep on mute, and then we can, if you have any questions, feel free to just put them in the chat, but let's let Dr. Wheeler just present. Thank you.
Well, I'm used to that in the classroom, but I haven't been in the classroom for 2 years. So anyhow, yes, a very large proportion of our children have mental health diagnoses. So that's my medical jargon there at the bottom. MH throughout this presentation stands for mental health. So about 1 in 5 children in the US has been actually diagnosed. But in the COVID crisis, I think this number actually now is low, but at least 140,000 children in the US have lost 1 or more caregivers. That means parents, aunties, whoever was taking care of them, they've lost them to COVID.
But again, I said, once you're using people's property.
Would it be possible maybe to, if you could mute, that would be helpful. Thank you. Okay, so a little bit more about this crisis. The APA came out just last month, the American Psychological Association, after they did a very large survey of parents across the United States to gauge the impact of COVID on their children and their families. Almost 3/4 of parents said that the pandemic was the worst thing that's happened to their child. And mental health related emergencies, of course, have been going up in children of all ages, all the way down to the age of 5. And as was already mentioned, the student to counselor and student to social worker ratio is double, at least double what is recommended by the National Association of School Psychologists. So that's where we were at, you know, before and during the pandemic. And the pandemic is ongoing. I mean, even today, as many people are dying every day of COVID as were during the worst days of the pandemic so far. So we are not done with COVID, or maybe we are, but COVID is not done with us. And I say that as a public health expert. We also have seen and documented distress in educators, both principals and teachers. And I know this personally from my work with Neolth, with teachers, with many of the conversations we've been having over the last 2 years with so many different members of the education profession, that the distress and the frustration and the lack of a real roadmap for the future are creating tremendous amounts of distress for people. And I'm going to go in a little bit to the physiology of stress to explain why that can be harmful long term, even when the stress is past or when it's quote unquote over. And so we have almost 40% of principals of secondary schools saying that within the next 3 years, they want to leave their jobs. And most of them that want to leave say that these are the biggest 3 reasons why. Obviously, blended and distance learning, as many of us know, myself included, it's been a challenge. There may have been some advantages to it. I still believe there are, but it's been challenging. It's required a lot of very fast, you know, alteration in all of the materials we use for teaching. It's been rough. But look at these other 2, providing guidance in mental health, both to students and teachers, are so frustrating and so challenging. And in my opinion, beyond the training that the average school principal would have to recognize and manage and actually facilitate effective responses to mental health emergencies in their schools as they continually become more and more frequent and more severe, not only among students, but among staff and personnel as well. So this is something that's affecting all of us. Now, the American Psychological Association made 3 recommendations for healing. And I was interested to see that the first one I saw on the list was bring mental health into the classroom. Now, if I were a teacher in high school, as many of you are, or lower elementary or middle school ed, I might look at this and say, okay, how do I do that? I'm a teacher, I'm not a psychologist, I'm not a therapist or a social worker. And that's what I want to talk about today. There is money out there, and the American Rescue Plan Act and others, other funding sources like ESSA are providing the resources to gather materials and other supports for students, but not a whole lot of guidance about how to spend that money. So states are making their decisions about how to spend that money. There are some health professionals being hired on temporary bases to fill in gaps, but that's not a lasting, sustainable solution. There is also effort being made in some states to help teachers learn about these skills, about recognizing and managing mental health crises in the classroom. But again, a lot of teachers feel that that's beyond their training or beyond, you know, why they got into teaching at all in the first place. And then there's also the recommendation to integrate mental health lessons into the curriculum. I would add to that just integrating mental health social norms into the classroom and into just the world that we create for our children to live in. Politeness, fairness, you know, simple principles like that don't have to be isolated into an SEL lesson. But ideally would become sort of part of the culture of the classroom. And this is one area where digital resources can be helpful because it's a common resource that everyone in the classroom is using however they're using it individually or collectively, and they can share and they can discuss and they can make use of these practices either individually or together. And so while it may be a little counterintuitive to think of a digital resource as something that promotes community, what we have found is that if you do it well, it can indeed promote community and promote the type of community that we don't want our kids to be involved in on typical social media, say on Facebook or Instagram or maybe TikTok. So that was one recommendation from the APA. I got to figure these. Okay, push that one. All right. The second, train teachers to address trauma. Again, let's put some more burden on the teachers and ask them to do more. Only 15% of educators in the survey done in 2020 felt comfortable helping students cope with the trauma of the pandemic. I'm an ER physician and a clinical psychologist, and sometimes I'm not comfortable dealing with people's pandemic associated grief and trauma. It is huge, it's massive, and it's going to be lifelong. And I think that the best thing we can do for teachers is share ways to recognize trauma when it shows up in the classroom, but then have resources immediately available to use to help the student, either for referral to a second tier of care or during class time or after class time, or in some way to feel that you have some sort of agency in the situation. In my many years of studying and writing about stress, one thing that comes up over and over again when we look at the deleterious effects of stress and the things that cause stress in our bodies and our minds, the one thing about a stressor that makes it particularly toxic is uncontrollability. When you are in a situation where you feel that the demands are consistently surpassing your coping resources or your material resources to respond to those demands, that's when the psychology and the physiology of stress start to happen. Now, for adults, this can be pretty corrosive long-term to their health. For children, it can be, and I don't want to be too dramatic here and say devastating, but in some ways it can be devastating if the trauma and the stress go on for too long, because it has a very profound impact on the development of the child brain. So at least to be able to see the warning signs and of trauma, or to recognize a child who is having ongoing trauma and displaying symptoms, we could provide that support to teachers, and that would be beneficial probably for all. Okay, and finally, ensuring long-term resilience. Now that I'm no longer in clinical medicine and now I'm in public health, this is something that we talk about all the time, the sustainability of innovations and the sustainability of the programs that are built around those innovations. It needs to be central to anytime you start something new. Yes, we are in a crisis, and so we need some stopgap measures for now, perhaps, but meanwhile, we need to be laying the groundwork for the next pandemic or the next crisis that happens, or at least to have an environment that is conducive to each child fulfilling their potential while they're spending time in school. And so this is what we mean by long-term resilience, resilience of the programs, but also resilience of these programs will promote resilience of teachers and students and school systems as a whole. So in public health, we always talk about this, about how does this particular intervention fit into the broader context that we are trying to have an impact on, and how will we, if we, the experts, are going to not always be there to maintain what's happening, what will happen when we're gone? How do we set things up so that this program can keep going and that people can still continue participating and benefiting from it? So I have to say that I felt good reading those 3 recommendations from the APA. I felt like they were good advice and a good roadmap for moving forward. However, by the same token, like I said, I think they also put a new burden perhaps on teachers, and in response to that, we need to be providing adequate support to teachers. Okay, so here's my whole career right here on one slide. This is my jam, stress and trauma. I can talk about it all day long. And if there's any demand, I'll do another whole hour all about how stress and trauma affect the brain's behavior and overall health of children, because I know a lot about this. But basically what we see as a teacher with a classroom or a professor with a classroom, there are 3 basic ways that stress and trauma show up. And the first one is chronic stress. Chronic stress is a physiological state that a human being gets into when they experience grinding long-term hardship Or often it will happen in the aftermath of one big serious event, like a breakup of a family, or the death of a parent, or the severe illness of a sibling. And then that can put a child on the path of chronic stress. Now, chronic stress is different from acute stress. Chronic stress is the type of stress that we worry about most when we talk about chronic disease prevention and also infectious disease prevention. The major physiological change that happens to a person under chronic stress is an increased secretion of a steroid hormone called cortisol from the adrenal glands. And what cortisol does basically is prepare a person to survive famine. That's what it is. It's the famine hormone. And this is why chronic stress, in part, is associated strongly. Chronic stress is one risk factor for childhood obesity and childhood diabetes, because cortisol has a profound impact on most parts of the body and many parts of the brain, including appetite centers and parts of the brain that cause things like seeking behavior, like rooting around, wandering around, being vigilant, not in this really hyper way, but kind of more in this sort of like quietly, feeling threatened sort of way. Eating behaviors are often profoundly affected by chronic stress. And this often can lead a child to obesity. And then of course they become a target for bullying and other types of discrimination. And so when a child has chronic stress and their cortisol levels are perhaps disrupting their overall physiology, it's hard for them to focus. It's hard for them to be more pro-social, because chronic stress is really a state of lack. It's a state of not enoughness, dissatisfaction. There's just never enough, and you never really feel comfortable or like you have done well enough. It can put someone in a very unpleasant psychological place as well. And there are decades of research on this, and I have created a packet for you of the evidence base for this talk, as well as a lot of different links and other resources that you can check out that will be given to all of you. But there's a very strong evidence base for the harms of chronic stress. Now, acute stress is something that's what we call fight or flight, right? And that's mediated by hormones that come and go in the body much more quickly. So an acute stress reaction can come quickly and end. And I know most of you, probably all of you, have seen that happen, maybe have it happen to yourself. The thing about this to remember is if a child is experiencing chronic stress, their nervous and endocrine systems are primed. And in the old days, we used to call that kindling, the kindling theory. But basically what it means is that the child is primed to have a stronger reaction to what others might see as a minor provocation. And this has got to be leading to a tremendous amount of behavioral issues in the classroom. So an acute stress response is something to, first of all, to be aware of, that it's going to be more common in children who have long-term struggles in their lives. And also that it tends to come and go, and they aren't always as difficult to manage as they might appear on the surface. Now, I have a lot of experience dealing with wigged out people freaking out right in front of me, and keeping my cool, staying calm, and doing what needed to be done for them. And this is why I love the way that Neolth is designed for use by students, but also has a lot of resources that are very helpful for adults. And also many of the practices that we offer on Neolth and that are taught in SEL are things everyone should know how to do. Breath work to calm yourself down, guided imagery, meditation, different types of movement, and art and expressive therapies. These are all part of SEL and part of mind body medicine, part of in my books, and just part of what we all should know how to do. And so when a teacher or a social worker is practiced in some of these skills, it's so much easier. It's right there in your back pocket. Okay, it's time to do some 4-8 breathing. It's time to do this, it's time to do that, because I do it for myself. And just briefly, this is a model of providing care that is not the same as what I was trained in as a physician and a psychologist, which is basically diagnose and treat. Wait for something bad to happen and respond to it, right? And what do we respond to it with usually? Medication, right? So it's really helpful to be able to feel like you have agency in a situation where a child is having an acute stress response, or you are, to know that you can modify your physiology in that situation and then perhaps be more helpful to that child. I really hate that whole old thing about the oxygen mask in the plane, because I don't like visualizing planes crashing in my mind. But it is true. Healthier adults probably are better able to guide children to better health as well. So that's another way that stress and trauma show up. And then finally, there's trauma and ACEs, adverse childhood experiences. And the S is for the large study that was done several years ago, looking at the impact of childhood trauma on long-term health primarily, but over the years, the research in ACEs has also looked at mental illness. Another thing another quirk that I want to mention is that, in my opinion, there is no difference between mental illness and physical illness. And I say this as a physiologist with all of my background, because almost every what we call a mental illness is marked by some physiological change. And a lot of them are marked by the physiological changes that I just briefly described to you in chronic and acute stress. And so we can measure them, we can follow them. There are biomarkers for mental distress that we can actually use when we get to third tier and actual treatments. So mental illness is real. It's not something that's just in someone's heads. It's in their entire being, and it's in their community and around them. We don't get well in isolation, and I don't think we get sick in the same ways in isolation either. And we can do a lot that will either harm or benefit others. So this is just a brief little slide about some of the outcomes of stress in a child's life and what you might be witnessing when you work with them during the day. Okay, and this has already been mentioned, but I found this map here that shows nationwide, because I know that you come from all over the world. You're not just thinking about your state in the United States, but here in the US, we have a high prevalence of mental health disorders in children. And because of the patchwork nature of politics in the United States, we have patchwork outcomes for health and all kinds of health, mental and physical health. And what we also see here is that in the states where you have a lot of children with mental health disorders, in many of those states, you also have a high prevalence of children with mental disorders not getting treatment. So again, this was a pre-existing problem before the pandemic, and now it's gotten much, much more severe. Okay, so going back to a little bit to some of what you see when a child is stressed or has experienced trauma, all of these are things that you might have seen, and they can definitely disrupt the classroom, and they can disrupt teaching. They can simply just make your day more irritating and hard to get through. It can disrupt the learning of other kids. And so I not having, and I won't even pretend that I have been that type of teacher, but you can imagine how disruptive these behaviors might be and how easy it would be to simply write the kid off as a behavioral problem. And even how justifiable that might be in some people's minds. But these are well-known symptoms, at least in the world of psychology and to some extent clinical medicine, signs and symptoms of a stressed or traumatized child. And so a lot of the measures that are taken in schools and in other settings only add to that child's stress and trauma, which will make the symptoms worse. And so we really haven't yet, we are, I think, formulating, and I think digital resources can be helpful in this process, a more effective way to respond to these behavioral issues that show up in the context of stress and trauma. So the Journal of the American Medical Association got on, it did a huge survey back in the mid, I don't know what we call that decade, the 2010s, I guess, the 10s. And really did it was actually a meta-analysis of what was going on with the mental health of youth that included over 46 million children. And again, just to reiterate, the prevalence of at least one disorder was close to 20% in that survey. About half of those kids were not receiving the care they needed. And these are the 4 states that had the sort of the honor of having both the highest prevalence of pediatric mental health disorders and the lowest availability of resources to take care of those children: Alabama, Mississippi, Oklahoma, and Utah. And a quote from the article said that these initiatives that assist systems of care coordination have demonstrated a reduction of these burdens. And what we mean by care coordination or systems of care coordination is what Dr. Grill was talking about previously, about first, second, and third tier levels of care. And I'll go into that a little bit more in a minute, but it's great to have those three levels, those three tiers of care, but they need to be very well integrated with each other so that we can go from primary to tertiary as quickly and effectively and efficiently as we need to for the well-being of that child. And so I also appreciate their advice here about, really thinking not only about sustainability when we develop programs for our schools or our classrooms and our students, but also thinking about how does it fit into the context of care that's already available or care that needs to be developed so that we can develop a roadmap, a full picture of what we have to offer and not have things siloed so that it's a big process, a bureaucratic process to get a child from one level of care to another. Okay. This is another piece of research that just came out recently, looking at where do kids actually get mental health care. And you may already realize this, or maybe you didn't. I didn't know this. I didn't know that just as many children who get psychological or mental health care in an outpatient setting, the same number of kids are getting it at school. That's huge. That is a huge responsibility that schools have either placed on them or taken on themselves. So even students with no mental health diagnosis, which would be the general population. And this is what we talk about when we talk about the first tier, or in medicine, we talk about primary prevention, or in public health, we talk about it too. This is something that is provided to the entire population, the healthy population, in an attempt to prevent progression to a second level or an actual diagnosis. And then once a person has a diagnosis, you're trying to prevent it getting worse, or you're trying to prevent complications. And that's called secondary prevention in healthcare. And in your setting, it's called the second tier of care, where now you have a student with an identified problem. And so you need to step up what you are offering that child, usually from a school psychologist or a social worker. And then the third one would be going to a licensed practitioner. And so even for students with mental health symptoms or a disorder, about the same number or the same proportion are getting their services at school as in the outpatient setting. And so I think this is an important thing to remember moving forward when detractors say, that this stuff doesn't have any place in the schools. It kind of surprises me that there are people who say this, but there are. That we shouldn't really be trying to provide mental health care to children in school, even though children spend, at least half of their day waking hours there. Okay, so I want to talk a little bit about SEL. I have about, I'd say 11 or 12 more minutes. So I'll, go ahead and do that. So as you know, you probably know the history of all this a lot better than I do, so I'm not going to insult you by trying to tell you every detail of how SEL got started and what it is. However, just a few little things that are relevant, I think, to our conversation today. First of all, President Obama signed the ESSA Act in 2015, and basically that provided funding for SEL across the nation, but each state was given the funds to do with what they would. And so from state to state, we see varying ways that the mandate to provide SEL education are being carried out. Around that same time, the collaborative for SEL, as you can see here, was started. Many of you have probably already tapped into their myriad resources, but they do have myriad resources and support for all types of people working with kids who need to provide SEL to them. So CASEL, along with others involved in the development of the SEL mandate, came up with 5 areas of competency that they feel should be taught to kids. And you probably all know them very well, so I don't need to read them to you, but they are really essentially not only about how a child takes care of themselves, but also how that child is able to interact with others in the classroom, both authority figures and their peers, in a peaceful, effective and productive way. And then the responsible decision making is sort of more of a long-term kind of skill that should be baked in, I would hope, as early as possible in a child's life. And there's been a ton of research on SEL and its various forms that it's taken and at the various levels of education in which it has been offered. But these are the 5 competencies that people generally come back to. And then here's just a little more fleshing out of each one. And if we look at this and we look at the 5 competencies, and I asked myself, well, where would digital resources fit in here? Certainly in the self-awareness, and particularly on the Neolth app, every time a student logs in, they have the opportunity to look back at how they were doing before. They very often will have the opportunity to do a very brief self-assessment to keep track of how they're feeling and how things are going for them. And then over time, they build up this record that is theirs and theirs alone that they can keep track of. And so this is a technique similar to journaling that also has ample evidence behind it as a very effective tool for working through anxiety and even in some cases depression and certainly trauma. Just simply keeping track of how you're doing is something that often can get lost in the busy day of a child, and especially when they're distracted by so many other things. So self-awareness is key, and self-awareness helps a child know when to use the tools they're being taught. That's a critical piece. Even at the Center for Mind-Body Medicine, where we do international trainings with adults all the time, the first thing we teach in our model is self-awareness, because you can't manage anxiety if you can't really recognize it in the early stages when it's still manageable before it becomes full-blown ruining your day or a panic attack or some other reaction or reaching for a substance or some other way to cope. Self-management, again, also a digital resource can help with that, because it's a very natural way for children to learn, to interact with material. All these kids are digital natives now. I was born in 1959, so I'm certainly not a digital native. I've adapted certainly very happily to the digital world, but it's nothing like these kids who have had this all their lives. And so this is a natural, normal way for them to learn things and to get information. And so for self-management, again, keeping track of how a kid is doing and having a wide variety of different approaches or different exercises and things to try, that's also appealing to a young person. The little bit of novelty, the little bit of something new is appealing. And then the relationship and social awareness skills, these are things that are missing in a lot of apps and platforms and resources that are offered for digital self-care, because they're kind of siloed to the person there. And there might be occasionally some link to, I know on some it'll be like this many other people meditated the same time you did, but there's not the type of social interaction and social influence that is available on Neolth. We have interviews, videos where I interview experts in the field about a variety of topics that are suggested by our student ambassadors and our users. And we also have a library of videos that are constantly being made by students themselves, where they talk about things like losing a boyfriend to death, losing a parent to death, and a variety of other things that are very hard sometimes for kids to talk about. And having another kid talk about it and to be able to really hear what they have to say and relate it to their own experience is powerful stuff. And that helps with social awareness and relationship skills. So there are many ways that a digital resource fits very well into this framework of the competencies of SEL. And there's an evidence base. CASEL's very happy to, they're very good clearinghouse for the evidence base for SEL. They collect whatever research they can find. And there is support for it in the research, where not only is in the moment or at the time in real time, where it's helping with academic performance for kids, especially at the high school and junior high level, but there's also longitudinal research showing benefits in young adulthood to SEL being offered in kindergarten. And so this is another thing that states and various school systems talk about. When should it be done? How should we offer it? For whom should it be available? And questions like this are tough, but I mean, obviously, I think in an ideal world, it would start in preschool and continue until through grad school for all kids, for all people. But resources are limited. And so those decisions have to be made. And so that's why this research is really helpful in helping to decide when, where, and how to provide SEL. The economy benefits. I speak to this very often when I'm lecturing in my job as a professor about how in public health, it's just amazing that people don't understand that a healthy populace is not just good because it's the right thing to do, but if you really care about the economy and that's all you care about, then you should care a lot about public health. If you care about military readiness and national security, you should really care about public health, because a healthy population can do anything. A sick population cannot do much. So investment in our children is investment in whatever sector of our society you care about. And I would love it if public health would start to frame, if we would frame our messaging more that way. I think we could appeal to more knee-jerk people who think public health is about nothing more than just giving things away to people who don't deserve them, which is something I have actually heard come out of people's mouths. Okay. In addition, CASEL claims, they claim that SEL fosters an equitable learning environment for all students. I think it has that potential. I don't think that's necessarily true based on what I've been told by teachers and students and what I've seen in the research, but that potential is there. Okay. Now there are also detractors and critiques, and some of them come from sources that are a bit more broad in the context, I think, of their thinking. And I think these are sometimes helpful critiques, but they don't always address what's actually going on in the classroom between teacher and student and teacher and class. And so while I think this is important to think about as we look ahead to long-term programs and maybe more on a national or state level, it's important to be aware of the critiques of anything that you're trying to promote or that you're trying to do. So first of all, yeah, the physical health and the mental health of our children compared to 37 other wealthy countries on the planet we're just last. We just really don't provide well for our kids. So what a lot of the critiques of SEL are saying is that we need to change the entire system. The whole thing needs to be redone, everything from the Department of Education all the way to, everything. And until then, we won't have justice or equity or fairness or a good learning environment for our kids. But we have to try in the meantime. And so while we have quotes like this about responding to flooding with sandbags and stuff, yeah, okay, that might be happening on a large scale, but we still have to think about what we do with our students every day. And I talk about this a lot because I'm a clinician who now works in public health, and there is a tension between healthcare or individual education, individual schools and classrooms, and the broader context of public health or the national mandates for SEL teaching. Okay, just something to be aware of. And here, when I was looking for this whole concept of Bandaid SEL, I mean, I can get what that sort of is alluding to, that you're putting a Band-Aid on a bullet hole, as this high school student put in her editorial that she wrote this month for her high school paper. And I found this because I did a Google search of Bandaid SEL, thinking, okay, there's going to be a lot about this. It was mostly a bunch of stuff about a teacher who uses a Band-Aid to teach kids something about fairness. And I don't know exactly where that phrase came from, Bandaid SEL, but this is a pretty succinct set of quotes from the article written by the student, just to again show that when we start these programs, when we're offering these resources to students, we need to think carefully about how they're going to be accepted and used by the students. And so at Neolth, we've had student ambassadors since day one, student advisors. We have a board of students, we have our advisors, we have interns, and our ambassadors, and they are all telling us on a daily basis, what would make this resource work better for them. And so if you check out the app, you'd see that the language isn't very clinical. And the reason for that, and we're all clinicians, or at least Catherine and I are clinicians, and kids don't really want to see clinical terminology in an app that they're going to be using every day to feel better. So we modified how things are presented. There are various ways that when you're building a program for students, that you can build it with them and build it for them. And sometimes you'll be doing things that may seem counterproductive or counterintuitive, but that's what they say is going to work for them. And the only intervention that works is an intervention that the participants actually participate in. So Unfortunately, the principal at this school basically just told the kids, you know, all of our test scores are too low, our grades are too low. We're going to do SEL to improve the report card. And she had a lot to say about that. But I agree with her, quote, before students can value an education, they have to value their lives. I think that is something we should all keep in mind going forward. And children value their own lives when they feel that others value their lives. They watch and hear us. They don't listen to us as much as they watch and observe and model themselves after us. And when they feel that we value their lives and well-being, then they in turn will value their lives and well-being more. I don't need to go into this much because I am getting short on time, and Dr. Grill did bring this up, but I just wanted to mention a few ways that a digital resource like Neolth would fit into these 3 tiers of care, and the all important seamless integration of these tiers of care. This is, as I said before, really important to have a system where the parts are all easily connected and a child can move smoothly through the system without having barriers while going from one place to the next. And so at the first tier, which is prevention and screening, and just and helping kids learn skills that are protective against the ravages of stress and trauma. So these are features that are built into Neolth that I really haven't seen anywhere else, where the content can be integrated into the curriculum or the curricula if they want to put it in math, English, and art, or wherever. Everything is tracked automatically. Every time you interact with the app, there is a record of that, of what you're doing for yourself, and you can put in information about how that is helping you, and so that you have this record that's being built. And again, that can be at this level private to each child, to each adolescent, or based on what the agreement is between the school or the parents. Then various forms of this can be taken. But a digital resource feels less clinical. It feels like something that kids are already used to, and having things changing and new things being offered all the time is what keeps kids interested, and even adults too, right? I mean, if something is just the same every time you go to it, over time it can get worn out. Another big barrier to mental health assistance for kids is worrying about stigma, both coming from their parents, from other children and others. And so you can actually explore tough things like, again, maybe a parent with a drinking problem. That would be something that would be really tough for a kid to talk about with their peers, or even a teacher. But they could go into an app during the time to practice, and that could be the video they watch, that they choose to watch, or the kids, input that they want to hear. How are other kids managing this? How does anyone else deal with something like this? And so overcoming stigma and having privacy while still having this record at this tier 1 level is really been shown to be beneficial for kids. At tier 2, then maybe counselors and nurses need to be involved. And this is, again, like secondary prevention, working with children with recognized difficulties or symptoms. And in this case, a therapist or a counselor can actually prescribe specific exercises, because the therapist or counselor will have the app too, and say, this drawing exercise looks interesting. Why don't you do that? And next time we'll talk about it. Or why don't you try this? Let's put a couple things on your practice calendar on the app, and on Tuesday and Thursday, and then next week when we meet, we'll talk about how that went for you. But not only would the therapist have that, the kids saying that they did it and it's in the app, but if it were set up this way, the therapist could also get a report on how the student is doing based on their self-report. And then finally, at the third tier of care, this is when a child actually is working with a therapist or a doctor. The app can be part of that treatment. The way that we have it set up, we already have a HIPAA compliant setup on our servers, and we are already prepared to be integrated into healthcare. And so moving to this third tier of care would be seamless with a resource like Neolth that probably wouldn't be quite as appropriate with perhaps other digital resources. So this is, again, more specifically how a digital resource for teaching and providing SEL could fit into a 3-tier program. And so what we have seen already And what we're seeing every single day, as we hear from teachers and students about Neolth and digital resources in general, is first of all, there are benefits to the student and benefits to the student that I already enumerated for you, and privacy being not the least of which many young people value. And then there are also benefits for educators. Again, in mind-body medicine, counter to going to traditional medical school, in mind-body medicine, I was told I can't practice it as a doctor until I do all of these things myself. So that when I teach a patient how to do meditation, I know what I'm doing because I've been meditating for 20 years. Not every day, but I know how to meditate and I do it and I know what it does for me. And I can discuss that with my client or my patient. Same thing with the teacher who's using the same app for themselves. Then now you have a resource that you all know well and that you're sharing together. So that is a real benefit for educators. And I'm going to stop there and see, I know the time got a little wonky, but if there are questions, we might have time, but will turn it over.
Sure. Thank you so much. Thank you so much, Dr. Wheeler. So before we turn it over to Q&A, first of all, thank you so much. That was extremely thorough, but very accessible as well. So really, spot on. Before we open it up for Q&A, I know myself and Dr. Greer would like to just say a few things just to kind of present the larger vision since we have everyone on the call. Again, our hugest apologies for the delay. But, I think, all good things, you should wait for them. And obviously, Dr. Wheeler certainly delivered. So just want to reorient, my name is Dr. Aziz Seixas, for those of you who, joined, after I introduced myself, but I am the Associate Professor of Psychiatry and Behavioral Sciences at the University of Miami Miller School of Medicine. And I'm just really delighted to be launching the Media and Innovation Lab, which is a flagship, one-of-a-kind program that focuses on digital health technology as well as innovation. And one of the areas that we're focused on, which is why we ensured that we needed to have a forum like this, was that we want to ensure that we provide support to the community. So one of the things that I oftentimes, and I'm a clinical psychologist as well, and many people have come to me and asked, hey, what kind of resources, what kind of digital mental health resources can I use for my students or for my children or for my nieces or nephews? And in many ways as well, even families need these, right? Or parents. Parents are going through tremendous fatigue in terms of either Zoom video conference fatigue or decision fatigue, where you have to be multiple things and multiple people and act in several roles in many ways. And so as, a father of two, I know what my wife and I have to endure every day. And I can't imagine how many of you are going through that. And so what we're really trying to do is to create a relationship and a partnership with the public. So everyone in the ecosystem, because you know what, I think we could do better. We could do better in communicating with you. So this is the first of many webinars. And so what we're going to be doing with Neolth, and I just want to, bring in Dr. Grill to add to this, is we're actually targeting different, areas. We're focused on South Florida, because of where, I work at the University of Miami. But if anyone is interested in bringing digital mental health solutions to their schools, their school district, whether it be in North America or internationally, please reach out. This is why I believe my colleague Dr. Grill put in that call to action Google Sheet, because we want to hear from you. We want to hear how we can serve you. And so we're going to be rolling out an incredible partnership with Neolth, going into schools, providing, educating teachers, guidance counselors, families as to what are the better digital mental health solutions out there and how to use them. And I think that those two things oftentimes go overlooked. So Dr. Grill, I'd just love to bring you in to see if you'd like to add anything, please, just to talk about what Neolth is doing and our partnership, together between the University of Miami and Neolth.
Absolutely. We're so excited about this partnership. I think it's so important. And there were some conversations in the chat about bringing in different stakeholders. And that's really something that we wanted to do at Neolth. And through this partnership with the University of Miami and some of the other universities we're working with is really coming into, community and working with the teachers, working with the educators. We talked in the chat about also working with the students and the politicians to really deeply understand the needs of that community. And then how we can come in and use technology to make these resources more accessible, to lessen the burden on the teachers and the counselors in the school, and just make access to care really seamless and affordable. So I put information in the chat if anyone's interested in learning more about our collaboration, how we're going to be using these digital resources in the school. If you want to be part of the collaboration and be using digital resources in your school as well, please fill out that form. I think there are a couple different ways that we use this program, of course, directly with the students, also analytics back to stakeholders like school counselors, even that 24/7 crisis care referral system and safety net that we talked about before. So the link is in the chat. We will also send out some information via email after this conversation, but thank you so much for sticking with us, and thank you, Dr. Wheeler, for that fantastic talk.
Thank you.
Thank you so much. Thank you. And so with that, Dr. Wheeler, you are really the star of the show. So anyone who has any questions, one of the things that we're gonna do is, if you feel comfortable enough to put it in the chat, I am happy to echo it for you. If not, I'm gonna ask you to raise your hand and I'll call on you appropriately, so that you can go unmute, unmute yourself rather. And you can ask Dr. Wheeler any question. And I believe we perhaps have about 5 minutes left for questions. Our apologies.
Or not.
I think you answered everything, perhaps, Dr. Wheeler.
Well, we did go over, so I'll probably have something else to do. I did create, as I said before, a packet of resources, and as soon as I can make the links work, when I make it into a PDF, it will be sent to everybody. And it has links to CASEL and resources for each state in the union and a variety of other, and the evidence base.
Absolutely. So what we'll do as well on our end, meaning our partnership with Neolth, that we will be sending an email with a recording of today's conversation, as well as other resources that Dr. Wheeler mentioned. And we want to create a community. And what I will implore you all is, for those of you who attended and learned something or had fun or just started pondering, please feel free, share it, because we're going to be having other sessions. I believe our next session is in April with Mashi. Let me see if I could share my screen quickly to see, just to kind of highlight that. So our next meeting, our next webinar is on April 8th with Allison Henry from Mashi Kids, talking about social and emotional learning using digital technology in schools. Difference being between the two is that while Neolth really focuses on adolescents in many ways, Mashi Kids really focuses on our little moshlings, our toddlers. And I think they too have suffered tremendously from the pandemic, and we're trying to provide more resources across the lifespan, from birth, to young ones all the way to young adults. So please tune in next time. April 8th, we're going to send out information. Hopefully it's okay that we keep you in our contact, because we want to create this network and this community where we can serve our kids and our families, especially those who are less fortunate. So if there aren't any questions for Dr. Wheeler or Dr. Grill, maybe Dr. Grill, do you mind sharing how could people learn more about Neolth? Is there a website that people could, or how do people get in contact with you? I saw that you just put Claire's email, but you know, what's next for Neolth, if you don't mind me asking? What's next? What's on the horizon for Neolth?
Absolutely. And I did see one question come in for Dr. Wheeler in the chat that you could look at while I'm speaking. But I think what's next for Neolth is, like I said, you know, we're really trying to understand how do we work with these different stakeholders, the educators, the school counselors, the administrators, and the students themselves to build up a resource that makes sense for them. Given their workday and their workflow, you have so much on your plate. Dr. Wheeler was a teacher. I was a teacher too. And when we know, you know, how difficult it can be. So how can we make something that kind of takes the burden away from you, but is also meeting these Department of Education mandates that are coming out, and is really engaging and exciting for students, not something that we're forcing them to do, but something that they go home and that they're wanting to use and are excited about. So I think what's next for us is really working with a couple different partners. The University of Miami is one of them, to come into these ecosystems and build out this distribution network and really start supporting the K-12 schools in the local community. So we're very excited about this collaboration in South Florida. Looking forward to having some clinical research and more data come out. We've already done some on our program, but more specifically through this collaboration, and then really starting to work with you all in the community to see, you know, what are your needs? How can we tailor this program more for you? And how can we make sure that all of your students have access to the resources that you need? So I'll put information in the chat around our website and how you can get in touch with us if you have any questions.
Thank you. And I think we have one parting question from Peter Gay. Please go ahead, Peter Gay, and unmute yourself and feel free to ask your question.
Please forgive me. This is not Peter Gay. This is Peter Gay's husband. My name is Andre Atkins. I'm just using her Zoom account because it's on the phone. Are you hearing me?
Yes, go ahead. Go ahead. We can hear you. Just speak up a little louder, please.
Wonderful. I'm saying I'm just using my wife's Zoom account.
Oh, so it's not Peter Gay, it's Peter Gay's husband. Okay, no problem. Yeah. No worries.
And that's Andre. My name is Andre Atkins.
Pleasure meeting you.
Wonderful. So this is the question, as there's a lot that is on my heart. One, from your end, is there some sort of a training and development component to what you want to do? And persons who participate, if there's such a venture, can get certificates and certifications that can be used or utilized in a context here in Jamaica, right? So in terms of professional development, because we have to be lifelong learners as counselors, right? That is something that we have to pay attention to as well. The other thing is, would you be able to offer counseling and help to other counselors in Jamaica, right? And in terms of resources, because this is one of the issues that we have here in Jamaica. We have a lot of issues and we have a lot of diagnoses, but there aren't many places that will sometimes go out of the way to ensure that certain things get done. So from your end, what is it that you can bring to us here in Jamaica? Perhaps set up a office or something here in Jamaica that can provide, assistance, support, counseling. What sort of a help is there for us here in Jamaica from your end?
Sure, thank you. Thank you so much. Two questions, excellent questions, and I'll have Dr. Wheeler and Grill chime in. First is, what kinds of training and professional development folks can benefit from? And obviously our colleague is outside of the North American context, but within the Americas. Dr. Wheeler or Grill, are there any such training programs, certificate programs that uses the mind, body, or digital mental health? Because it's an excellent point, because if you have this unregulated use of several digital mental health solutions, who is regulating it? How do we know and how can we train folks to best utilize that? Does any of that actually exists?
It's a very new field, which I think is exciting in digital mental health. But that means that I think some of these things that you brought up in your question, they're still happening as far as the regulation and the training. I think one thing that we'd love to hear from you is it possible that we create a CEU course based on some of the information that we're building today, in partnership with the University of Miami, Emoshi, and the other groups who are building this, because we've been spending a couple years, really deep diving into this digital health in schools. We have a lot of insights and we'd love to share them with the community. So we did see a lot of interest in this webinar today, and we're thinking about creating a CEU course, so we'd love to hear that from you if it's something you're interested in. As far as the regulations, I'd say, that's still, I think, a lot of work in progress. The FDA does regulate medical devices, but typically doesn't regulate SEL or digital health products. I think one way that you can kind of go through and vet products is looking at their partners. Do they have university partners? Have they been doing the clinical research? Do they have educators, doctors, and therapists who understand the landscape, who are creating the product? And then also looking at those ESSAs, as Dr. Wheeler mentioned, evidence-based tiers, which describes, how much research have they done on their product and the impact that it has on students. So I'll be brief here, but we can send out more information in the information packet email that we send later on about those evidence-based tiers and how you can kind of figure out if a product is meeting those tiers.
Excellent. And I think the second question, not to let you off the hook too quickly, is will Neolth or any digital mental health, well, you can only speak for Neolth. Does Neolth have any interest in taking their product to global? I think the colleague mentioned about, somewhat setting up shop, or at least creating a solution that might be tailored or customized to the Caribbean context. Any thoughts around that?
Absolutely. I think it's the more we can expand, the greater impact we have, and that's all really what we're about, is this impact in helping more young people. I do think it's a great idea, when we come into a community, to really work with them and kind of co-develop and figure out what's specific to their community and their needs. So we are looking at things like culture and making sure that this is informed for that specific population. But Neolth is currently available now on the App Store in the US. And then there is a browser version if you're outside of the US that you could take a look at. I'll put it in the chat. It's just cloud.neolth.com.
Thank you. And the one thing that I can say, oh, go ahead, Dr. Wheeler, go ahead.
I just wanted to just put a shout out. I heard you ask about training in mind-body medicine, and I'd be happy to talk about options and programs that I'm aware of, and including the one I'm involved in as a trainer. If you want to email me at claire@neolth.com, I'm happy to provide whatever you want to know about that.
Excellent, thank you. Sorry, not to interrupt you, but the only thing I was going to add was that we at the University of Miami, this is something that we're thinking very, very deeply around. How is it that we can establish training infrastructure? So this is currently part of our outreach, our engagement and outreach infrastructure, but we want to ensure that it cross-pollinates with our educational domain, whereby we can start to offer trainings, whether be informal initially, and then we can work out an opportunity whereby these trainings can be more formalized. So excellent point. I think I saw someone else's hand was up, but I believe they may have lowered it or they had to run. So folks, I just want to be mindful of time. I know we've gone over, but I know that you all are still committed to our kids and our families. So thank you so much for staying. Huge round of applause, and I thank you so much on behalf of myself and Drs. Grill and Wheeler. Just really thank you so much for your patience. We will see you soon, and you'll be hearing from us. So again, we have a moment, let's turn it into a movement, and we believe in health for us. So with that, thank you so much and have a wonderful, wonderful day.